one thing we haven't talked about, Dr. Gomez, is bleaching, teeth whitening. There's lots of stuff out there. You can pick it up at CSV or Avia or whatever. Anyway, of those in those grocery stores and in those pharmacy stores. And then there is the dentists who have all kinds of ways of doing it. Again, enlighten us of the workability and the usefulness of each of them.
Well, we have so many different products in the market right now. You're going to see a lot of advertising on TV. You can buy it on the internet, but we always recommend the patients to come and have the bleaching done at the dental office, because you have to take in consideration all the issues before you bleach your teeth. You have to make sure that you don't have any root exposure, you don't have any decalcification, you don't have any enamel deficiency, that if you bleach your teeth, you might cause other damages. So, but a lot of products in the market, they work. Some products might take a little longer than other. If you do the home bleaching, is more time consuming than the office bleaching. You get the benefit and the result quicker, and it's being guided by the professional, the dentist. It's going to watch and check your teeth before doing the procedure. And it's more safer for the patient to use the office bleaching, because it's being monitored by the doctor, instead of the products that you can buy on the pharmacies. You really don't know the complications, and if you are eligible to use those kind of products. If your teeth are okay and no damage can be caused by those products to the teeth before you start using them.
Okay.
That's my advice would be to the patients to. I'm sorry.
Go ahead.
I said my advice to the patient will be. My advice to the patient will be to check with the dentist before try anything. When patients come to me and ask me about buying any products in the pharmacy, I said, you can try, but your teeth are okay. You can try. If you don't get the result that you want, then you can, always come to the office and get the office bleaching.
So tell me, what procedures are you using in your office to do the whitening or bleaching, whatever it's called?
I use the light procedure where you use the products and you place the light on the teeth, and it takes about 45 minutes. And
is that Zoom? It's called Zoom or whatever, stuff like that.
We had two different company, and then they both work good. We had the Bright Smile, and we had the Rembrandt, which is another company. It's similar to the Zone. It's just a different company.
Right. It's just that sometimes what people know. So how long does it take? A patient comes in, he sits down. Will he be more or less having his teeth the way he wants it, with one visit, an hour or two later, or are there usually several visits, or
Well, it depends. The patients have to be evaluated. Some patients, they have a high what can I say? They high expectation, and sometimes they have to realize the limitations on those procedures, and we want to make sure that the patient understand that before we start doing anything. But the patients get evaluated first, and then we see how the condition of the teeth, and we take photos. The whole procedure between getting the patient ready, taking the photo, make sure the patient has no decay, no fillings on the surface that it's going to be bleached. Because if you have, let's say you have any restorations on the front of the teeth, all restorations, and if you bleach the teeth, the teeth will change, but the restoration will not. So we had to make sure that the patient understand that once you get a bleaching and you have some restoration, the restoration might have to be changed later because you're going to have a difference in between shades between the restoration and the teeth. And the whole procedure takes about, 45 minutes. The actual procedure takes 45 minutes, but the whole procedure might take an hour and a half, between getting the patient ready and the photos and all of that.
Okay, wonderful. And let's just say that, is that something which can be repeated 2-3 years down the road if the person keeps drinking, let's say, red wine, keeps smoking, keeps drinking coffee, and whatever it may be which stain his teeth, and so it comes back, can he then do it again?
Yes, it can be done again, but when we do it in my office, what we do, we gave the patients a home kit that he's gonna do a home like a booster every time. Every month he might use it for half an hour just to make sure that the teeth will stay will stay the same, that they will not change too soon. Because if you bleach your teeth and then you go back, do your normal life and you will start eating and drinking wine and smoking or coffee, whatever you do, any food that we eat has color in it, and those colors gonna stain your teeth if you leave it like that. So they have to keep it up if they want to keep the shade that they have, and they have to use something at home just to to maintain it.
Well, that's wonderful. So basically you do the big treatment, and then every month or so, and depends on the lifestyle of the person, he kind of for an hour or so goes and does a little bit of a touch-up or clean-up with the material and praise you give him. Absolutely great. Thanks a lot, Dr. Gomez.